Hello to North, and thank you for taking this time to review this important training that we need to do. This PowerPoint presentation will take less than 15 minutes of your time, but what we're going to focus on is the post-procedural care with a focus on TR band management and neurovascular assessments following a PCI procedure. We will be reviewing where to find the physician order. We will also be reviewing signs and symptoms to look for and where to document those signs and symptoms and where to document on the progress of our TR band removal. At the end of this, there will be an attestation. I will need you to click the link. If the link is not available with inside this PowerPoint presentation, the link should be either above or below. Ask somebody, find that link. You have to do the attestation to show that you have watched this documentation. And also part of the attestation is going to be a teach back. So when we meet in person, it'll be either myself or another leader on the floor. We will need you to show us where to find the orders and how to activate the flow sheet and then the timing intervals. So let's get started and let's go for it. So the background on this, a TR band, it's used to maintain hemostasis after radial sheath removal. Sheath is already removed in cath lab or PACU by the time our patients reach us, typically. So our True North responsibility is to monitor for bleeding or complications, safely deflate and remove the TR band, and then of course correct documentation. Okay, so on this particular page, this is a copy of the actual physician orders that are inside Epic underneath the orders tab. And then when you scroll down to the post-PCI procedures, this is what you see. This is everything you need to know about what you are going to document for this patient. So this is pretty foolproof. I mean, this should be your Bible, so to speak. Orthostatic blood pressure. It tells you exactly when to take it. This is a post-sheath compression device removal. When bed rest is complete, it's done post-procedure. You take your orthostatics. It tells you post-procedure distal pulse site assessment, puncture site care, straight cath. It already has that order built in case you need to do that. Syringe inflated radial compression device right. Of course, that can change based on the type of PCI the patient had. If it was femoral, it would be femoral. Telemetry completed revascularization procedure, 24 hours. Vital signs, whatever you are going to need should be already in this order. I like the fact that they also, in this particular order, they have an order in here to may remove telemetry to shower. So everything is here. What we need to make sure that we are doing is that we're following this exactly. Document, document, document. Okay? So breaking this down, distal pulse site assessment. Okay. Puncture site, care, and vital signs. So wherever your site is, eventually we're going to be checking pulses. So our monitoring intervals as far as the schedule for us to document what the doctor has asked us to document in that flow sheet is we're going to do Q 15 minutes times 4 upon arrival with the TR band in place. Then after we complete that, we'll do Q 30 minutes times 2, Q 1 hour times 4, and then Q 4 hours. And of course, don't forget to do your orthostatic vitals in addition to these after the band has been removed. So once the band has been removed, all the air is out, you're going to do your orthostatics, and then we go from there. So this starts 60 minutes after application. We're going to start by removing 3 mL of air every 15 minutes. Use only the manufacturer provided syringe. Monitor for bleeding after each step. Total air removal should be approximately 15 mL, and that's the max. So it could be a little less, and we're going to look at an example in just a few minutes where it's not quite 15 mils. If bleeding occurs, immediately reinflate air to achieve hemostasis. Wait a minimum of 30 minutes after hemostasis before resuming deflation. Document each reinflation and assessment. Notify the provider if unable to control the bleeding. Final removal steps. After final deflation and stable site, remove band by undoing fastener and rocking gently. Okay, we're rocking gently as to not dislodge the clot. We need that there. Apply sterile dressing, and then, of course, date, time, and initial. Clean area, discard supplies, and, of course, hand hygiene. And we're going to do hand hygiene before this also. So hand hygiene before and hand hygiene after, because you guys know that. Clinical alerts. So we're going to notify provider for recurrent bleeding, absent or diminished pulse, pain, cyanosis or cool extremity, spasm during monitoring. We're going to make sure we document total air remove, time of final removal, and then dressing application. Here is a snippet of how to add the flow sheet. So your PCI patient has arrived on the floor, you have looked at your orders, and guess what? You have nowhere to document. I can help you with that. So what we do is, first you're going to click on flow sheets, as you can see up here. Number 1 is flow sheets. Then take your eyes over to number 2. Number 2 is where we have the little magnifying glass where we're going to find a flow sheet. So we're going to click on that magnifying glass, and number 3, once you click on the magnifying glass, the select a flow sheet template pops up, as you can see over here, this way. And then we're going to click number 3, which is facility preferred list. That's where we're going to go to find the number 4 arterial venous sheath, and that's the assessment flow sheet. So we have 1, click the flow sheet, 2, click the magnifying glass, get your select a flow sheet template pop open, and then number 3, we're going to click facility preference list, and then we're going to click number 4, arterial venous sheath. Okay, assessment, and then we're going to hit over here the accept button. Once we hit the accept button, we will get that flow sheet. So this right here is just a little cheat sheet going back over how to add the flow sheet. I won't go into detail just because we just talked about it, but you can screenshot this or whatever you need if you would like a quick reference. Now, this is the flow sheet, and this is what it looks like. We start documentation 1 hour after the procedure, and that is based off of those physician orders that we looked at the very beginning of this PowerPoint presentation. Here it says 1534 and then 5 seconds. We're going to bump it up to 1535, rounding up. And that's what here the nurse in this particular section is what she did. She started charting, or he or she started charting at 1635, so 1 hour post. And she took out her first, as you can see right here, 3 mils of air. Okay, so this is another view of the flow sheet a little bit later in time. So we want to be sure that we're following the correct documentation times that the doctor has placed in those orders that we looked at the beginning of this PowerPoint presentation. So like I said, we're going to follow those orders to a T. We're going to follow the interval schedule, Q 15 minutes times 4 upon arrival with the TR band in place, Q 15 minutes times 4 again after the TR band removal, Q 30 minutes times 2, then Q 1 hour times 4, and then Q 4 hours. We want to make sure we're getting all that documented exactly how the physician wants us to document it so that we are compliant. Now, I want to talk further. This is actually a pretty good example. Let's see here. Yes. As you can see here at 16:50, our nurse documented that they did the 3 mils of air, which left 7. And 15 minutes later at 17:05 here, we see that there's a little note. Okay, so more than likely what happened as this nurse came, she or he took out another 3 mils and the site started bleeding. And of course, that's not our desired outcome. So what this nurse did is she infused 6 mils. So she infused enough for the site to stop bleeding. In this note, when I clicked on it in Epic in real time, it stated that the site started to bleed, a physician was notified, and 6 mils of air was reinstilled into the TR band. So she documented correctly, she put a 0 there, and now that we have the amount remaining, it's back at 13. So this is good. Make sure that you're putting in all document for everything. This will always save you as good documentation. So she did correct there, he or she. Now, the waiting period. When we covered those physician orders earlier in this PowerPoint, the physician orders specifically said waiting period is not less than 30 minutes after bleeding. So this nurse here, it looks like she waited 55 minutes. So that's fine. It is not less than 30. I wouldn't recommend probably more than that, but this is great. She still did, so when she restarted to release the air again, she did exactly what she needed to do, or he or she, I should say. Did it, and it was every 15 minutes, okay, until we were down to 1 mil of air. And then if we were able to scroll over on here, we would see the rest of this documentation, so that's good. So I can't state enough, once you've read those physician orders, follow those physician orders to a T. We cannot go wrong if we're following those orders. And then notifying the physician for anything that they need to be notified about, spasms, extra bleeding that we cannot control, those types of things. And that is actually it. Let's go to the next screen. Okay, and that's it. So let's recap over everything that we've done. So far what we have gone over is how to do the correct neurovascular assessment and documentation for our PCI patients with the TR band. So just to recap on the process is that we are going to go and find the physician orders under the orders tab. We're going to look over all those physician's orders. It's going to tell you exactly how you are to document. Then once you have read over your orders, make sure that your flow sheet is activated. And we know that we're going to go to flow sheets, we're going to click the magnifying glass, and we're going to find that exact flow sheet that we need to document on, and then we're going to follow those physician orders and document exactly as the physician has asked us to in that flow sheet. So here is the attestation. If you're not able to click on the attestation here, there should be a link either below or above somewhere around this presentation that can get you to the attestation that you have watched this and that you will be doing a teach back and showing us that you know how to get to the orders and to the flow sheet and how to document. All right, other than that, thank you very much.